Was it an exhausting experience? I mean, 7 hours to get a 10-second
Yeah,
test.
um, for sure, exhausting. It was sweet to see families taking care of their kids, but it was also really heartbreaking. At 6 a.m., well, it's early in the morning when I had arrived, there were some families where the kids were here. It wasn't just parents holding the line.
Mhm.
And these kids, they had a bad cough, they were sneezing, they were moaning from their little bodies aching. They're probably feverish, and that's why they're here. And to be outside, like it looks pretty nice right now, although it's kind of chilly. But in the morning, it was like 4 degrees. Like 10 minutes after I arrived, the line had already doubled. And by around 7 a.m., they were at capacity. They could handle 400 cases uh, throughout the day. And, like at 6:20, they were already at 10% capacity with me. And then, like, by the end of the hour, they were at full capacity. Took 7 hours, and it's not I'm grateful that we have a two-parent family. We could share the burden a little bit. We have understanding employers who had some flexibility with our schedule to basically take the entire day off to do a 5-second test. Uh, but not everybody has that, and it's just amazing to think that in this day and age in Ontario, we can't manage to get this done. We knew for 6 months that the second wave was coming. We knew that the schools and the universities were going to open, and that was going to increase the rates. And there just seems to have been zero planning for it.
Can you show me what's the lineup like now?
So what you see behind me right now is the lineup for like basically the adult line, not the kids line.
Okay.
They separate at this center. The kids are on one side of the building, the adults on the other side. This is the adult line that you see here. I mean, these folks I think are gonna be getting the end of the line is probably about 5 hours from getting a test. It takes about that time to get inside, and then about an hour to get processed.